Okay, so in this video, I'm going to be talking about filler red flags. If you'd like to learn more about filler red flags after you've gotten the filler, stay tuned. Quick disclaimer, obviously if you have any concerns with your injectables, you should always call your provider's office and take it up with them. But here are some red flags. If this happens to you, you can consider going back if you needed to. Okay, so the first set of red flags I'm going to be talking about are safety concerns and things that you probably want to go back to your provider for. I have my list over here, so I'm just gonna be looking down. But when it comes to fillers, any excessive swelling, any bruising all over your face, any discoloration, if you squeeze on your skin, you should be able to see circulation, meaning like if you were to take your arm and press hard enough, it goes white and then it turns back to the original color. If it doesn't turn back to the original color, then that's a sign. But again, that's an assessment that your provider should be doing, not you. Now, all these things I mentioned are signs of what we call a vascular occlusion, which is basically when filler blocks a blood vessel. Now, it's important to know the signs because if you spot the signs, then it doesn't have to be a big deal. You would go back in, they would dissolve the whole area with hyaluronidase, which is an enzyme that breaks down filler. So it's important to just be aware, and if you have any concerns, let them know. Another reaction that you could have is an allergic reaction. Now, most of the time, if that were to happen, it would happen right then and there. Again, extremely rare because not a lot of people are allergic to filler or lidocaine and other things that we use with our injections. One thing I do mention is that if you're allergic to bees, to be specific, yellow jacket bees, I think it is, then I wouldn't inject you with filler just because the hyaluronidase, which is that enzyme we spoke about that breaks down filler, and the bee venom are very similar in structure. So you risk running into an allergic reaction if you were to dissolve filler. So it wouldn't happen right then and there, but in an emergency situation, or if just down the line you didn't like the filler, you may face an allergic reaction, which obviously is not ideal. And when I say allergic reaction, I mean like an anaphylactic, can't breathe reaction. Now, a few other signs to look out for would be signs of infection. So this often doesn't happen right away, maybe a week down the line, maybe even more. And how that can manifest is as, redness, warm to the touch, maybe some pussing, like any infection in anywhere else in our bodies. It can look pretty similar. There may be like delayed inflammatory reactions with like nodules and stuff like that. So if anything happens at the site of the filler on your skin, just be aware that it may be related to the filler. So always go back to your provider. Sometimes family doctors and stuff like that don't catch it. They don't realize that you had filler, or maybe you didn't tell them, or maybe they know that you had filler, but they don't know enough about filler and the different types of injectables to know that the reaction was associated with the filler. So it's always a good idea to let your provider know as well, because they can give you the best advice. So these potential complications are extremely rare. It's not something you see happen every day, but it is always important just to learn and know about what you're doing with your face. And lastly, I just wanted to mention a bit of a more common thing that can happen with lip filler is it can trigger cold sores. So if you were to get lip filler done and then a few days down the line get a cold sore, don't be alarmed. Just do what you would regularly do if you had a cold sore, no big deal. So those are all potential complication signs, but let's talk about what's normal. So swelling of the lips or cheeks or chin or wherever you got the filler done, absolutely normal. Swelling can look pretty ugly. So it can be uneven, so one side can be more swollen than the other. It can also look like somebody punched you in the face. So that's normal, don't be alarmed. Unless you have swelling that goes beyond the area that was injected and is really excessive, then don't be alarmed. Lips especially do look worse before they look better. So That's all part of the healing process. Now, there are some people that don't swell at all or very minimally. So if you are one of those people, consider yourself lucky. It's not a bad thing, because I tell people, hey, you're gonna swell, and then they're like, hey, I didn't swell, is everything okay? I'm like, yes, everything's perfectly fine. You're just not one of those people that's likely to swell. And then another normal reaction would be bruising. Again, bruising should be localized to the site that was injected. So if you got injected in your cheeks, you shouldn't have swelling that goes beyond the cheeks. If you were injected in your lips, you shouldn't have swelling that goes, beyond the lip region. Not swelling. Did I say swelling? I meant bruising. The bruising shouldn't go beyond the lip region. With bruising, it varies. So just because you didn't bruise once doesn't mean you won't bruise the next time. Just because you don't bruise the next time doesn't mean you won't bruise again. It's all about A, the injection technique, B, where you are. If you've been drinking the night before, or on blood thinners and things like that, you're more likely to bruise. So again, bruising doesn't really say much. Some people get upset with bruising, but it's just a normal response that our bodies have. Our face are full of blood vessels. If we puncture one, it will bleed out, and that's what manifests as a bruise on your skin. Again, ice is just gonna be your best friend. Always ice. That's gonna help minimize those side effects. Lastly, with the lips, a lot of people get what we call Fordyce spots, and what those are is little tiny oil glands that we naturally have occurring on our lip, and when we get the filler, it kind of just triggers them to show as little white spots. Those are absolutely normal. It can happen with lip flips as well. I know it happens to me when I do a lip flip. And they're just oil glands, nothing to be concerned about. They'll usually settle on their own, or do their thing. Now let's talk about the cosmetic undesirable outcomes, which aren't harmful to you, but just aren't the most aesthetic looking. First and foremost would obviously be lumps or bumps. So if your filler feels lumpy or bumpy, and at this point we're talking past the 2-week mark. Before the 2-week mark, they may be lumpy, but after that, they should feel pretty smooth. Then you always have the option to dissolve a lump or massage it out, but you can go back to your provider and deal with that. And then another one would be unevenness, if one side has more filler than the other, or an unbalanced lip proportion. So we always want the top lip to be a little bit smaller or equal to the bottom. Sometimes people get filler and things go out of balance. Either the top lip's too big, or the bottom lip's too big, or one is too small. So then, you kind of have to see if you need to add or remove. And then lastly, the one cosmetic thing that we kind of don't want to happen but can happen is filler migration. So if your filler was to migrate, we'd have to dissolve it and start again. Usually that doesn't happen at the 2-week mark. It happens months down the line, and a lot of people think they have migration 2 weeks afterwards, and it's like, no, it's either remaining swelling that's not fully dissipated, that maybe needs another week or so, or the filler was misplaced. It's not considered filler migration if the filler was initially placed in the wrong spot. So those are just some things to kind of look out for after you get your filler done. Again, I didn't want to scare anyone with this video. A lot of these are extremely rare, but it's just something to kind of, keep in mind. I hope you guys enjoyed this video. If you have any questions, leave them in the comments. I answer all questions. And I will see you guys in the next video. Bye.